Bismillah Rahman Rahim. Assalamu alaikum. Today we will discuss about eczema or atopic dermatitis in children. Do you know globally dermatitis affected this eczema atopic dermatitis affected approximately 230 million people, and from those there are 15 to 20% are children. So the word eczema, which is derived from Greek word which is meaning to boil over, and which is a good explanation of a flare up of eczema. So today I will talk about what is eczema, what is the pathophysiology of eczema. Sometimes in theory exam you will face a question, they will give you a question of eczema, but they want to ask from you about the pathophysiology because there is a gene involvement. What are the characteristic patterns of evolution and how to manage a child with eczema? Can it be life threatening? Yes, it can be a life threatening. If a baby who is having an eczema, it can be a life threatening if you will not diagnose that how it could be a life threatening. Is there any investigation for life threatening condition? These are the examiner's favorite points. And how to educate parents to prevent flare ups. So, eczema is a chronic recurrent genetically influenced skin disorder of early infancy, childhood, and also in the adult life. It is a genetic deficiency of skin barrier function. So, atopic dermatitis or eczema is the most common form of eczema, a condition that causes the skin to become itchy, dry, and cracked. So, these are the multiple definitions of eczema. Actually, there is a gene, one gene which is involved. That gene is called flagrin gene, which is in our stratum granulosum. There are five layers of epidermis in our skin. So the layer which is stratum granulosum, it is keratohyaline granules, which releases lamellar bodies and which make lipid layer. So that gene is in a stratum granulosum, and that gene is called flagrin. And the function of that gene is to moist our skin, and it has an antibacterial quality, and also some may be possible photoprotective. So this gene is mutated in a patient who are having an eczema or atopic dermatitis. So this is also predisposing factor for the atopic dermatitis. So if you don't remember other things, just to remember that the gene is mutated, which is a flagrin gene. Loss of function of mutation of genes encoding the flagrin protein. It has three phases according to the age: infantile phase, childhood phase, and adult phase. So each phase has a different clinical features. Yeah. So infantile phase, which begin at between 1 and 6 months, but usually starts after 2 months, because there is another differential diagnosis during infantile period as seborrheic dermatitis, infantile seborrheic dermatitis. So in infantile seborrheic dermatitis, it usually starts at the age before the age of 2 months, and it starts from the scalp, behind the ears, then goes over to the body, and napkin area are involved in the seborrheic dermatitis, and also the scalp. There are some scaly patches over the scalp, and this is also called the cradle cap. Those babies who is having seborrheic dermatitis, infantile seborrheic dermatitis, are more prone to develop eczema later in life, but it is not an eczema. And they are saying if there is no itch, usually it is not an eczema. So itching must be there to diagnose for the eczema. And infantile phase, which may last 2 to 3 years, and a rash composed of red, itchy papules, plaques, many of which ooze and crust, so symmetrically distributed over cheeks, forehead, scalp, trunk, and extensor surfaces. but nappy area are usually spared during infantile phase. The childhood phase, which is between 4 and 10 years, it has also a symmetrical distributed symmetrically distributed our wrist, ankles, flexure surfaces of arms, legs, circumscribed erythematous scaly lichenified blocks. Lichenification happens when the lesion becomes blackish after a prolonged itching. So that becomes lichenified, which may secondarily infected, and it is another feature. This is cheilitis. It has some lesion in the angle of the lips, and they may have the very sore lips, and also on the perioral area in the childhood phase. And the other thing, they have a Denny Morgan lines. What are the Denny Morgan lines? This is a sign of ongoing inflammation and edema. You will see the additional folds of the skin below the eyes, which are called Denny Morgan lines during the childhood phase in atopic dermatitis or eczema. In adulthood, they have mainly involved flexure creases of arms, legs, neck, and hands and feet. How to diagnose eczema? Because there is no any investigation to diagnose, it is totally a clinical diagnosis, and it is important to diagnose because it is a lot of burden on the parent if child is not sleeping at night because of itching due to secondary to eczema. So definitely mother will not sleep. Even the all family members can be affected because of irritation of the child, because child will continuously cry. And if you if you have an experience, if child will cry, it's not possible to anyone at home to sleep a peaceful sleep. So it can disturb all of the family. It could be disturbance, and it is a challenge for the mothers and also for the caregivers and also all family. So if you will treat it properly, they may have a good sleep at night, and they may have a good quality of life for your. Only they need an education, they need a proper medication, because not the one day game. It is a for long process. Sometimes it is a long time, even lifelong. Sometimes it will go away. So typically it is a clinical diagnosis in which there is a itchy skin condition in the last 12 months and 3 or more of the following. Visibly irritated red skin in the creases of your skin at the time of examination by a health professional. A history of skin irritation. Generally dry skin in the last 12 months. And history of asthma, a hay fever, or the flagrin gene, which is also involved in any kind of allergy. So those have a family history of allergy, like a first degree relative, any sibling or parents, they might have an asthma, hay fever, allergic rhinitis, and atopic dermatitis. So the condition usually start before the age of 2 years, and it does not apply to children under the age of 4. The management point of view, education of the parents and the patients, especially in recognition of bacterially infected eczema and eczema herpeticum, because this is a kind of emergency. Eczema herpeticum is a kind of emergency condition in a patient of who is having eczema. So it is very important to educate the parents the kind of lesion and flare-ups. During flare-ups, they should seek advice as soon as possible. And if it is eczema herpeticum, it needs an urgent intervention. We will discuss next about the eczema herpeticum. Avoidance of exacerbating factors and allergens, like if they have a allergy with the dander of the birds, with the smoking, with any other uh, perfume or any smoke, anything, if they are allergic, any soap, perfume soap, they have to avoid this because it may exacerbate the symptoms. So parents already they know the exacerbating factors, because if there are pets at the home, and parents are saying we have removed the pets, now it's almost for 3 to 4 months. So we think it's not because of pets, but allergen of dander of the pets remains in the house for around 6 months period. So if they will remove the pets from home, and the dander of the pets remains there for the 6 months. So after 6 months, the dander will go. So they need an education. Parents need a good education for the patient who is having, and for the children who is having eczema. Nail care: keep the nails short to lessen the trauma from scratching, because the itchy lesion, and this is a very intense itch. Even the small babies, they are itching themselves. The treatment is with emollients, emulsifying ointment, creams, both oils, which make the skin moist. As you know, the skin becomes dry, and when the skin becomes dry, they have also itching, which can be more worse. Topical steroids: and the potency of steroids, which is requires skeleting. Initially you will give very low potency, and slowly and gradually you can increase if it is not responding. The potency of steroids, like mild potent and moderate potency, and also very severe. In severe eczema, you need a potent steroid. So mild atopic eczema need hydrocortisone, and moderate potency for eczema you need a clobetasol, butyrate 0.05%, and potent steroid for severe atopic eczema you need betamethasone 0.1%. But if someone is treating direct with betamethasone 0.1%, so you don't have any other option. So it is, if it is mild symptom, please start with the hydrocortisone, and when the baby is improved, you should go back from betamethasone to clobetasol, butyrate, and then hydrocortisone. You will not use all the time in a mild eczema the betamethasone, because it is a potent steroid, and you need to use in severe atopic eczema. It may affect on the uh, it may affect on the baby's skin. And other is a tacrolimus topical, which is called calcineurin inhibitor, which is inhibiting T cell activation and thereby suppressing the inflammatory response. This is a recent advancement of the treatment or management of eczema, and this is a third line agent which should be used above the age of 2 years. And also they sometimes they use a phototherapy if all above measures are failed, and antibiotics and antiviral drugs for secondary infection like eczema herpeticum. So what is eczema herpeticum? Eczema herpeticum is it can be a life-threatening condition, and it is because of herpes simplex virus 1, or sometimes rarely it also may be because of herpes simplex virus 2, but mostly it is HSV1. So they may present to you with the pain, lethargy, and some systematic upset, deterioration of eczema, failure of eczema. They have the vesicular lesion, and which is confirmed. How to confirm that this is atopic eczema? Because they have the deterioration of eczema, vesicles, crust on different parts of the body, sometimes peri-orbital as well. So can be confirmed by the viral skin swab, or also we will take same time will be the bacterial swab. And if it is eczema herpeticum, you should take the viral swab within 24 to 48 hours to diagnose after the vesicular lesions are appeared. So we have to educate the parents that if there is any vesicular lesion appears on the baby's skin, you should come back to the doctor, because it could have a life-threatening condition. So if there are no systematic symptoms, we will treat the oral acyclovir. And if the baby is systematically unwell, high-grade fever, baby is having any other systemic symptoms, then we will treat IV acyclovir, but the some other local guidelines, we have to follow the local guidelines, because some hospitals and some centers or dermatologists direct they give the IV acyclovir. So we have to follow the local guidelines. But according to the UK guideline, they are giving the oral acyclovir if baby is systematically well, and if baby is systematically unwell, they are giving intravenous acyclovir. Definitely, if systematically unwell, you will also treat with the IV fluids, and you will manage according to the baby's condition. So if there is a periorbital involvement in a patient who is having eczema herpeticum, we should involve the ophthalmologist as well. Why? Because they may have the permanent damage, permanent blindness, permanent damage of their vision, because it may cause a corneal ulcer, which also affect the baby's vision, and it can cause the permanent damage of the vision. So this was a little bit about the eczema, and it is a vast topic. Just I covered the things which are very common, and usually the examiner are asking from these areas. But do not forget about the eczema herpeticum. It is usually, what is eczema? Eczema is atopic dermatitis. Other name is atopic dermatitis, and the gene is involved, which is a flagrin gene mutation, loss of function of a loss of function of mutation of flagrin gene. And the function of flagrin gene is moisturizing our skin, and it has antibacterial properties, and it is also some properties of photoprotective, which is on stratum granulosum of epidermis. You know, there are five layers of epidermis and stratum granulosum, which is having lamellar bodies which make lipid layer. This is the reason water is not going inside our body. If this layer would not be there, if we will swim or we will bath, the water can enter our body. So this is the childish question. Child may ask that if there is a certain water comes out from our skin, but when we are bathing, why water doesn't go into our skin? And eczema herpeticum and secondary, this is a secondary infection which could be eczema herpeticum and secondary bacterial infection. Eczema herpeticum, you should be able to diagnose. It have a vesicular lesion which may be crusted and punched out lesions, uh, confirmed by a viral swab from taken from the lesion. And you should involve the ophthalmologist and to see for the corneal ulceration if there is lesion on periorbital area. And treatment, if systematically well, then you will give the oral acyclovir. If systematically unwell, you will give intravenous acyclovir. And thank you very much. Assalamu alaikum.